Watery eyes, a runny nose, and that nasal itch you just can't get rid of. Pollen is blooming in the valley, so between COVID-19 and colds, how can you really know if it's allergies or maybe something else? This morning, our Nohelani Graf sharing the true giveaway and also some really great ideas on how to find relief. We're all feeling it right now.
That's the truth, Kaylee, and it's such a shame here because, you know, I'm out at Papago Park this morning. There are already people hitting the trails, and you just love seeing all these extra little pops of color, but you also know with those blooms come the pollen, that's for sure. And I, for one, when you add in the wind, have been ready to scratch my eyes out here the last couple of days especially. And really, it's your eyes. That's the telltale sign if you're trying to figure out what the problem really is. Is it a cold? Is it something else? So you're going to have those deep circles, those dark circles under your eyes, and also the redness. The other thing is you should not have a fever or body aches. If you do, then it is something else. When it comes to relief, local pharmacists tell me their own go-tos are those steroid nasal sprays that you can now get over the counter. Flonase and Nasacort are the ones who make them. There are generics as well. Their second choice is to go to an antihistamine tablet, and not all brands are created equal there either.
Would stick with Zyrtec, Zyrtec, or even Allegra. Claritin has kind of been phased out. It doesn't work as well.
And she says you shouldn't take Benadryl either. That's not going to help. When it comes to your kids, Neilmed Neti Pot is going to help flush their nasal passages, but she cautions that you not use tap water. It must be drinking water. If they're under the age of 2, then a saline nasal spray will help. But as always, talk to your own pediatrician first. And if you insist on being outside, even on those high pollen count days, then what you do when you get home can make all the difference.
May want to wear a mask outdoors when the pollen counts are high. You may also make sure when you do come home, you're taking off the clothes that you were using outside. And if you had pets with you, you're wiping them down with some baby wipes or any kind of wipes to make sure they're not bringing in those allergens.
And if you can, on days like this morning, when the wind has been blowing, try to avoid your time outside because that's really when the pollen gets kicked up. You can always check the pollen count at pollen.com. And Kaylee, if you are still not finding relief, you've tried all those things, then she tells me it's time to get a blood test because you might not have an allergy at all. It might just be an irritant to something else, and you can solve that another way.
Okay, I mean, really fabulous information. I mean, our jaws were dropped here when you were talking about, when the lady was talking about Claritin, right? I mean, Claritin is such a go-to for all of us.
I did the same thing.
All right, no, hey, thank you.